Dr. Jarrouge was a practicing doctor when he started seeing his own health fail him. At the same time, he also had many patients coming in, kind of like a revolving door, as he explains it in this episode, that really at the root of many of their health issues was metabolic disorder. So today we're going to have a really important conversation on how he transformed his life and now how he's transforming the lives of people all over the world. So stay tuned. Welcome back to the Evolving Wellness Podcast. Today I have Dr. Jarrouge here on the podcast. I'm always interested in having conversations with medical doctors who have spent a lot of time and money on their education and really invested everything because they had the desire to help others. And like many of the other medical doctors we've had on the show, we have seen that this system is flawed in many, many ways when you follow the standard of care, which is very unfortunate. So I really want to keep having conversations like this. And I'm so appreciative of Dr. Jarrouge for coming on the show and sharing his story. Make sure that you head down to the show notes to follow him and share this information with anyone who needs to hear it. Again, the medical system, I think all over the world really is pretty flawed when it comes to dealing with the core of a lot of health issues, which is metabolic disorders. And this view that nutrition is only minimally impactful is really hurting a lot of people. So without further ado, let's jump into today's episode. Thank you so much for being here. Today's show is brought to you by Upgraded Formulas. They have my absolute favorite magnesium. You can get the best and only clinically studied stabilized nano magnesium supplement on the market from Upgraded Formulas using my code YOGI for 10% off. Did you know that magnesium is actually required for over 800 enzymatic reactions in the body? This clinically studied magnesium has proven to improve sleep quality and energy by over 60%, specifically improving light sleep measurement by 90%, REM sleep by 150%, and deep sleep by 250%. That means more energy, better mood, and deeper sleep. Who doesn't want that? What makes this the best on the market? This specific magnesium is nano magnesium, which means it is easier for your body to absorb and use. In fact, it is absorbed up to 99.99%, which means you'll feel the results instantaneously. A lot of people are quick to talk about the benefits of sunlight, but what gets often missed in the conversation is the benefit of darkness and the importance of protecting yourself from blue and green light after sunset. That is why I choose Viva Rays as my go-to source for protecting my circadian rhythms. You can use the code YOGI to save 15% off at Viva Rays. Now, you may have seen some of these studies popping up. I call them fear-mongering about blue blockers not being effective. And that is a partial truth because when you use blue blockers that are clear or that have not been tested with a spectrometer to actually block what they say they do, they will not protect your circadian rhythms. And they are not catching those key wavelengths that you need to be blocking in order for your body to be able to repair, for you to make melatonin, which is a master antioxidant. And artificial light at night has been in the scientific literature extensively linked to a host of hormonal cancers, obesity, diabetes, and all sorts of metabolic issues. That, again, is why I choose Viva Rays as my go-to source for protecting my circadian rhythms to allow my body to get adequate darkness at night. You can use the code YOGI to save 15% over at Viva Rays, and you can actually trust that they block the frequencies of light that they say they do. Thanks to Viva Rays for sponsoring today's podcast. Hello, everyone. Welcome back to the show. Today, we are going to have a really important conversation about metabolic health. So, Dr. Jarrouge, thank you so much for being here today.
Thank you, Sarah, for having me.
Yeah, it's a pleasure to have you. I was just talking before I turned on the record button. You know, I've been following you for a while on social media. I know we run in a lot of the same circles, and my husband, he kind of is a late adopter to everything that I do. And I think he found you on Twitter and was showing me a bunch of your tweets. And he's like, yeah, this guy's really on to something. He's actually a medical doctor that kind of thinks similarly to you in nutrition. You should talk to him. So,
Awesome.
um, yeah, thank you for coming. And
Yeah, I'm glad we got to connect.
I would love if you could just share, because you are someone who trained in our, standard medical system, and now you think completely different about nutrition. So I'd love if you could just tell us your background, your story, all of that.
Absolutely. I mean, nutrition and diet was the last thing on my mind. I never thought about it. So I went the traditional way. I mean, I grew up in Lebanon overseas. So we kind of ate healthy just naturally, and I didn't think about it. At the time, people usually didn't have a lot of overweight. But I wanted to be a doctor. So I always wanted to do that. So when I moved to the States, I went through the traditional route of college, undergrad, medical school, fight for residency, and I did internal medicine training, and then I did a training in nephrology, kidney diseases, and because I liked kidney physiology and I wanted to practice just kidney related stuff, but then I realized it's mostly chronic diseases, and at the time I hated it because I was like, I can't fix chronic diseases. That's what I thought. So I thought it was just more medications, dialysis, stuff like that. So I ended up doing hospital medicine. So for 9 years, I worked at the county hospital, then another private hospital in Houston, and I was managing people coming into the hospital for
Mm,
multiple issues, from stroke, heart attack, infections, you name it. But the common theme is chronic metabolic diseases was always there, diabetes, obesity, complications of all of that stuff. And over time, I just started to wonder, like, what are we doing? Like, it's the same people revolving. And simultaneously, I had my own health kind of issues. One, I was gaining weight throughout residency. I gained about 35 pounds over a span of 7 to 8 years. My blood pressure was elevated. I had chronic back pain that I couldn't pinpoint why, my energy was low. So and my back was giving out every few months, where I can't do anything for several weeks. I don't know if you've had that problem before, but it's really hard, like the lumbar area when that gives out. I even have a cane as a reminder from many years ago.
wow.
But at that time, 2015 or so, I was desperate. It was like, let me try something related to food because I kept hearing like food improve your health. So at the time, I did the Whole 30. During the time I'm working in the hospital, I didn't think much about it. I tried Whole 30 for myself, and I felt amazing. I lost initially 10 pounds. My back pain was improving. My mood was improving. A lot of things were improving. So I did it again for another month, and I lost another 5 to 10 pounds. And then I stopped, and I started having back pain again. So I started kind of connecting the dots, and I went back to doing paleo this time. And after paleo, keto was kind of becoming very popular around that time. So in 2018, I dived into keto 100%, and I felt amazing for the longest time. But then I heard about Carnivore, and I was going to conferences. So when I did Carnivore, I lost even 5 more pounds. I did not know I had to lose. And then when I lost then all the 35 pounds, I started to wonder, there's something to diet, and my blood pressure went away. I also, by the way, had a pre-diabetes, the beginning of pre-diabetes. My
Mm,
A1C was like 5.7, and that went away. This is when the light bulb went off. It's like, people need to do this. Pills don't solve any problems. So I started to become vocal, at least with my patients in the hospital, telling them alternate ways to get better, but I couldn't follow up with them.
mm,
Um, so I was growing to be more frustrated with the system. And then COVID hit, and I was taking care of a lot of COVID patients. And the common theme is people metabolically unhealthy are ended up in the hospital, ICU, dying, regardless of age. And this is when everybody was on lockdown. So I started getting active on social media. I started with Twitter initially, then I did Instagram, just trying to put the message out there. And I started a side hustle to coach people. I figured everybody's in their homes, try to help them, and slowly this kind of caught on, and I've felt more rewarded because people were getting healthier, and slowly kind of moved away from hospital medicine. And now all I do is really help people improve their health with nutrition, and hopefully get them off medications.
yeah. I mean, Houston has got to be up there as far as obesity and
Yeah.
poor metabolic health, right?
Yeah, absolutely.
Yeah.
Yeah.
Yeah, I mean, I'm down here in the South and in Georgia, and I know it's pretty bad here too. I mean, I feel like it's bad everywhere now, and more doctors are faced with these patients that just, I mean, they just come in, like you said, it's a revolving door of, and it's medication after medication. I feel like doctors are so poorly equipped to really get to the root cause of why people are just so sick.
Yeah, absolutely. I mean, we were only taught to use a hammer, if you so everything is a nail in a way. For acute medicine, someone having a heart attack, stroke, or accident, I mean, the system is great for that because they fix things.
Hmm.
But chronic diseases, just every day we have more drugs and to younger people, and it's just sad state of existence. And the reality is just our food environment, not just food. I mean, we can talk about a lot of things, but the environment we live in is toxic, whether it's products or chemicals or food. Everything is leading to worse health, and it's not getting any better. But people are waking up, I think, and I
Hmm.
noticed that the past few years, a lot of people want to get better, and then they're taking things into their own hands against medical advice. A lot of times, doctors are still pushing back; they're still stuck in the old ways, and they're not helping their patients follow a healthier diet. In fact, they tell them the opposite of what they should.
Yeah, there's a lot of pushback. You know, I feel like when I have elderly parents or my mother, and she's struggles with her health and all kind, and they don't ever with the nutrition, they're like, eat more grains and just eat more low fat and don't eat don't eat the meats and don't
Yeah.
eat all the eggs and just, yeah, that's the advice that she keeps being given. And it's like, I guess that's just how they're telling everyone to eat. And it's unfortunate because we didn't get to where we are eating those types of foods. Like it's not how we didn't have all these different processed foods and things in a box and things like that have a million different ingredients. And we didn't, as a species, we didn't get here from those types of foods. But the message out there, and I feel like with a lot of doctors that I've encountered, is like, it doesn't, what you eat doesn't really matter. So, do you get a lot of pushback from other doctors when you talk about your story and then how you've been able to help patients?
I try to stay away from contacting doctors in conventional way, but yeah, people ridicule or dismiss it. I mean, I hear it secondhand from the patients, like
Mhm.
especially rheumatology. Like a lot of people with autoimmune disease, these patients
Oh,
are asking
yeah.
rheumatologists, which are one of the smartest doctors out there. They ask them, can they do anything with their diet? And the quick answer is no, it doesn't
No.
matter. Uh, that's less intuitive than obesity and diabetes. You'd think there should be a way, but even then, people are just prescribed medications. But yeah, doctors are still. I don't know if it's a lack of time. They're so busy. They're not looking outside the box. A lot of them, they're unhealthy themselves. Maybe they project they don't want to change their diet. Big pharma, I don't know. I mean, it's
Yeah. It's so multifaceted. I
yeah,
don't
but
think
I know
any,
they mean well, so I know that no doctor wants to hurt their patients. There's plenty of patients to go around. It's not people say, oh, people want profit or they want to
no,
keep the
no.
business going. There's plenty of business. I mean, I'm in the business to get myself out of business. I mean, if you think about it, I'm getting people healthy enough so they don't need me,
Hmm.
and there's never enough doctors to do that.
Yeah, and that's what I was going to say. You basically said exactly what I was going to say. I don't think anyone becomes a doctor because they want to hurt people. I think any doctor that I know and that I talk to offline, they got into being a doctor because they actually wanted to help people. And I think it's the system that is set up. It
Yeah.
sets doctors up to fail. It sets the patients up to fail. Everyone is set up to fail because we've got pharmaceutical companies and we've got insurance companies and these outside entities that really don't have the best interest of anyone in mind other than how to make more money. And it's just it's a horrible system that we have set up, and it doesn't, the patients have to be smart, right? Or you just kind of get pushed through the system.
Yeah. I mean, if you think about it, when you start medical school, you kind of really clueless. You're a 22-year-old. I mean, people are starting later, but you don't know much of anything and you trust that you're going to be taught the right thing. So you get systematically I mean, brainwashed, whatever you want to call it, or programmed to follow
Program,
a
yeah.
certain path. Yeah, there's research this, evidence-based this and that, but you don't, that's, you know what you're shown, and you go to conferences, they're all big pharma sponsored or big food sponsored. So, but you don't notice until you wake up, then all of a sudden you see all this stuff.
Mhm.
So you reach a point, that's how you know how to treat, and using unconventional means, it seems crazy. But yeah, I tell people Asian food cannot be responsible for modern diseases. Maybe someone said it before, but that's kind of common sense is lacking. We want to blame meat and eggs and whatever fat on modern diseases and ignore that all the ultra processed stuff that's been around for the past 100 years.
Yeah, we didn't, weren't, those are not health foods. And there's a lot of pushback that I see of people saying all foods fit and all foods are fine in moderation. And I just, I don't know. I think those foods are engineered
Yeah,
to not be eaten in moderation in the first place. I don't think people can control themselves once they start eating them.
correct. I mean, they hire these engineers to create these products that are addictive. To this day, if I eat that stuff, I mean,
Oh,
you
yeah.
know, you can't stop at one potato chip,
Mm-mm.
uh, and that's the good side of it. I mean, potato chips, you still think of it, okay, potatoes, but still, I mean, they engineer the kids for specifically all their cereal and all that stuff.
Yeah.
So it's addictive.
Yeah, and the packaging to be attractive. And it's like, if my son, he's 19 months, he's just been here. I don't send him to daycare. We're blessed enough so that we can have him home and I can really control everything right now. And it's like he loves eating a steak, love eating meat off the bone, and he loves these foods. He doesn't know what goldfish are, and he doesn't know what cereal is. He doesn't know what that is because I've never introduced it. But I know that if I did, he'd eat that stuff. And it's just like it's how we're programmed. And if you turn on the television, there's someone said the other day on social media, I saw this post and it said, if your food has a commercial, then you probably don't want to be eating any food that
Exactly.
has a commercial. I'm like, it's
Yeah,
compelling
but you don't
information.
see a commercial for steak or strawberries
Mm-mm. No.
I mean, the sad thing, sooner or later, he's going to be exposed. He's going to go to a birthday party. He's going to taste something. He's
Yeah.
going to, wake up that sugar demon, create
Hmm.
that sugar demon at some point. But so, yeah, it's hard.
Yeah, you can't shield your kids from everything. I think we just have, my goal with him is just to try to teach him and like, okay, this is really good food. This is going to nourish your body. This food may not make you feel so good or give you good
Yeah,
energy. And
yeah, yeah.
I'm at the point now, I don't know about you, but I've been to other people's houses for parties and things, and I see like all the stuff in a standard American pantry, like the pretzels and the chips and the cookies and the snack bars and the little cakes and the full sugar soda and juice. And I've been to those places and I'm like, I'm really hungry, but none of that actually registers as food, as something I would rather just fast. I'd rather just
Yeah,
eat
yeah.
my own body fat instead of eating something like that because I know it's not going to help me feel less hungry. It's not going to make me feel good, and it's not worth it to me, you
It's not
know?
worth it. But you're at a point where you don't care about people, the pressure and all that stuff. But people
No.
go for
Mm-mm.
pressure, like I feel bad. They want me to try this and try that, and like it's not worth it. If your diabetes got worse just because you indulged, feeling worse. But yeah, you see it in the supermarkets. You just look at people's cars, and
You're
I'm
like, oh, wow. Yeah. I know. I try not to be judgmental. I try to always, position myself as somebody who's empathetic and understanding because I've been at that place in my life where I really just didn't know better. And I think a lot of my family members, they don't know better. And if we act judgmental and we're like rude and act like we're better than other people
Oh
because
no, no, yeah.
what
I
the
don't judge them. I actually feel bad for them because
me
they
too.
still haven't woken up. I mean, I used to have bags of Kit Kat and
Oh
Snickers,
yeah.
those small ones, thinking I'm making better choices, and I just get addicted, like Nutella out of a jar. I would come from school or work. I'm like, shaky from probably hypoglycemia, and I would just have a spoonful of Nutella out of a jar. That's how crazy I
Oh
was.
yeah. Yeah, I same. Just, it's snack, it's fine. It's not going to do anything. But then I think it's something you have to really experience for yourself when you switch like you did and you're like, "Wait a minute, I don't have back pain anymore. I have more energy. I feel better. I'm sleeping better. All of this stuff." It's almost like you just have to do it
Yeah,
so that you can really help others get to that
exactly.
place.
Exactly. Yeah, almost every practitioner or nutritionist, dietitian, coach, whatever, doctors, they went through it themselves to
Mhm.
become advocates of this lifestyle. And anybody who didn't, they mock, they call you names, they ridiculous. I mean, it's sad, but
Let's talk about protein because it is so important that our bodies get enough protein. But a problem I see as a clinician is that people will increase their protein and they will begin to have digestive issues. This is because your body can only absorb protein that's been broken down into smaller building blocks called amino acids. If you cannot break down and digest this protein due to a sufficient supply of enzymes, your muscles and your body will be starving for those vital building blocks. This is why it can be very helpful to take a high quality enzyme. The one that I have been using and trusting myself is called Masszymes by Bioptimizers. Masszymes is a full spectrum enzyme formula with more protease than other commercially available enzymes with 5 different kinds. Plus, it contains all the other key enzymes you need for optimal digestions. You can try it today risk free. Their 365-day full money back guarantee is the gold standard in the industry. You can use my link in the show notes and my coupon code SKW to get 10% off your order. Check out Masszymes by Optimizers. Yeah, it's sad. And it's going back to the rheumatologists, autoimmune conditions are rampant. I don't know about you, but it seems like every day I have more people in my community, my private community, that are coming to my work and they're really suffering. And the diet piece is significant in autoimmune. I think it's nervous system, environment, all these other things are definitely important, but they do as a foundation, I think, have to look at diet because what's the alternative? Steroid treatments and these kind of
yeah, they don't cure anything.
system suppressants. Right, exactly.
Yeah, I tell them you got nothing to lose. Try it, give it a month. I mean, almost everybody improves to some
Mhm.
level.
Yeah. What kind of dietary strategies do you employ with people who have autoimmune conditions?
It depends where they're starting from. If someone is
Mhm.
already like clean keto and they're not getting better, then you can go swing all the way carnivore. But
Mhm.
generally, people are coming from standard American diet. So I don't go carnivore all the way unless they want to, because
Mm.
it's just
Hard.
sorry, there's a message here. Yeah. Uh, so I tell them, hey, let's remove sugar, grains, processed food, and prioritize whole foods, prioritize protein, healthy fats. So it tends toward the ketogenic side of things, but more on a higher protein side, especially if they're trying to lose weight. If they're
Mm.
not, then I don't care. So whole food, animal based, low carb approach generally for people. And then individually, if someone having issues with nightshades, or other oxalates, whatever that they might have issues with, we can also eliminate them. Most of my patients have been metabolically because that's what I focus on, obesity, diabetes. Some of them come with a package of autoimmune diseases and they improve even without going extremely
All the way to carnivore.
elimination. Yeah, carnivore. Yeah.
Yeah, I find the same thing. And I think it's if you tell someone who's coming to you with a laundry list of issues, hey, we just have to get you down to carnivore, they're just going to say, I'm going to go find somebody else. I'm going to
Yeah,
go
yeah,
for something
exactly.
else.
Some
Yeah.
people come to me, it's like, oh, I started carnivore last week, but I want some support. Okay, fine. Uh,
Good.
but I tell them, hey, long term, if you want it, it's great. You don't have to remain. At the end of the day, you need the lifestyle that you can sustain. You do
Hmm.
carnivore for 30 days, you feel good, but you go back to your standard American diet, you didn't do anything.
Right, exactly. And you could end up gaining more weight because you've
Exactly.
just, yeah, yeah. So when someone comes to you, like you said, you kind of tell them, let's cut out the grains and the sugar and all these types of things. What other types of things do you implement with people? Because I assume like what you're doing now mainly is just this sort of thing, like working with metabolic health, right?
Right, right. So mainly, so I'm a simple. I like simplicity. So I don't know how you feel about supplements, but generally I'm like, I don't care about supplements.
Yeah.
Most people, some people have deficiencies, but generally, unless like your vitamin D is like 5, I mean, super low, that's the only supplement generally you use, or electrolytes and some magnesium when you first start.
Yeah, I was going to say magnesium is the
Yeah, magnesium.
only
And
one that
I
I'm
don't think
like,
of it as
most people need
supplement.
that. Yeah, no, it's a
Yeah,
mineral.
exactly. I think of it as more a replacement of what we should have in the food, but transition. But generally, yeah, it's like eat your food, don't drink your food, don't. I mean, even protein shakes, people like. I don't care. I mean, sure, if you're vegan, vegetarian, you're not getting enough, or you're sick, you're not able to eat, fine. There's ways to supplement, but
Mhm.
generally, try to eat your food. I try to work. There's a lot of mental, emotional aspect of it. Why
Yes.
they're snacking, why they're eating bad. So addressing that aspect: sleep, stress, exercise, of course. But I don't have them do all at once because they can just get overwhelmed. So focus on the diet initially, even if they don't want to move a finger. Just start eating right. As their aches and pains and improve and the energy is higher, they just start to move, and then we can start adding strength training, walking, whatever it is. But it really doesn't require as much as people think. They don't need to live in the gym. They can do things at home. They can use their body weight. So yeah, real food, whole nutrition, and then some. I do labs, of course, at baseline. I repeat, and depending what they have, and then tailor things to the individual.
Yeah. I think that's so important because I know a lot of people that will just kind of give a blanket supplement protocol or a blanket diet and just say, do that. And it can be not as effective if you're not really looking at the individual and where they're coming from, right?
Exactly, exactly. Yeah, and not everybody I realized I learned that the hard way that not everybody needs to be like high fat. I used to be keto, keto, keto. I
Yeah.
realized high fat for women post-menopause, for example, they just don't lose weight when they do that.
Mm-mm. Mm-mm.
So I have to kind of higher protein, lower moderate fat. The carbohydrates for women and around the cycle. Sometimes if you
Mm-hmm.
go too strict, and they can actually they crash, or they
Mm-hmm.
so ups and flows, and you can use healthier carbs, potatoes, sweet potatoes, things. So things you learn from just doing it. So there's no. So my answer is always it depends. What are you trying to accomplish? All these things. But there are some basics, which is excess sugar, grains. At least in the US, the grain for whatever reason is just much more inflammatory than abroad.
Well, there's glyphosate and
Yeah, that's
it
yeah.
blocks the leptin receptor in the brain and causes inflammation. There's so much to the
Yeah.
grains. People are so attached to their oatmeal, though. It's insane.
Yeah, yeah, and that's a huge thing. I get people off oatmeal all the time. Just replace it with eggs. That alone, and that makes a huge difference because sets
Mhm.
a day to be on the right path when you're not
Yes.
on a roller coaster with sugar.
Right. Yeah, that's the thing that I go to with people first. I don't know about you, but I'm like change the breakfast first because if you can get somebody's morning in a better place, get the sunlight in the eyes and stabilize the blood sugar with some protein and fat, eggs, or just even leftover dinner. And like
Yeah,
everyone's attached to having to have like breakfast and like just have like a leftover, leftover steak and cold vegetables for breakfast. And that's probably going to do you a lot better than the bowl of oatmeal or the bagel or the
exactly.
avocado toast that has no protein in it. You need that. Otherwise, the whole day you're going to be apt to more appetite issues, cravings, mood swings, all of that stuff because you started your day off the wrong way, right?
Exactly. Yeah. The
Yeah,
first meal is always the most important one to get right. It sets it down for the rest of the day.
absolutely. How do you feel about coffee and other drinks like that in the morning?
Well, I'm not sure. Uh, I love my coffee. I don't know if it's affecting me negatively. I don't feel like I sleep well. Some people are affected. Like I've had
Mm.
people, hey, cut back on caffeine because that's one thing that's disrupting their sleep, and then it helps. I think coffee is, I think it's healthy. Now people can overdo it. It's a drug, it's a
Mhm.
stimulant, so it affects them. So I not drink it late. But people have to know. Some people don't do well drinking coffee first thing in the morning. Some people, so I'm kind of, leaving it out there. And then if it's a problem, then anxiety, jitteriness, poor sleep, then we can affect it. How do you feel about coffee in general?
It's funny. I was working on an email talking about it just before we got on here. And I went off of coffee when I was trying to get pregnant because and that was in 2021, because I just wanted to do everything right and get my hormones and my adrenals in a good place. And I didn't notice huge anything until I checked my HRV. And it took about 2 months. And then my HRV actually doubled after 2 months, after it was like all out of my system. And then that holiday season, I tried it again just because I like coffee. I
Yeah.
enjoy it. So I had some during the holidays, and after about 3 or 4 days, my HRV dropped back down to that low number it had been at that
Yeah.
January. I was
Yeah.
like, oh man. So I went off of it again. Then I ended up getting pregnant that next January, and I stayed off of it through my whole pregnancy and during breastfeeding. And now I just make sure that I wake up, go outside, have my breakfast. And then if I want to have a cup of coffee, I do, I enjoy it. Is my HRV like sky high? It's good. It's decent.
Yeah.
And I
And
try not to
plus,
drink it every day. And I try not to drink it multiple cups or after 9 a.m. Have some rules around it, but I don't think it's the root of all evil, honestly.
no, I think there's some benefit for some people, but yeah, plus there's so many other problems people have to
Mhm.
address before. I mean, some people are on the health optimization. People are healthy, they're trying to
Yes.
maximize their health. I'm not even interested in that field. I like
You're like, come to me with
when
that's
you're like
who I
a
want to work
million problems, I get excited because I want to fix problems. But if you're already healthy, you want to get that, squeeze out the last 5% out of your health. I'll be making things up.
Yeah,
I'll
I know
tell them
that's
I
how
don't know.
my friends and I, we always talk about this. Other practitioners were like, we really want like the morbidly obese person. Like, that's our dream client who's like eating cereal and snacking all day
Yeah,
and drinking
yeah,
soda. Like, that's the client we want because we can just help them the fastest and they see the most, like, they change these really small things and they have great results. But then you get the woman that comes to you that wants to lose the last 10 pounds and she's already doing all this stuff and you're like, oh man, this is
yeah.
we're gonna
That's
have to
hard.
get really more, yeah, you gotta get more creative. And then it's like, someone writes to you and says, I need to lose 10 pounds, and I'm like, let me see pictures, because do you really need to lose 10 pounds, or is it just up here that you think you need to lose the 10 pounds? Like, there's just so
And it
many.
goes both ways. Some people say, oh, I only need to lose 10 pounds. You look at them, it's like, no, it probably is 30, 40 pounds.
There's that.
Again, it's not an image thing. It's just a metabolic health.
Right.
Uh,
So for metabolic health, like, do you have a BMI that you shoot for with people, or do you more so look at parameters like blood work, blood sugar? Like, how do you measure
yeah.
that someone is in a better state with their metabolic health?
So it's easy when you're obese and BMI over 30. I don't
Mhm.
look into BMI too much. I look at belly, abdominal circumference,
Mhm.
as body composition is a lot of things. So one, everybody knows when they're overweight. I mean, when you get into normal thin, like a woman or a guy, then you can, okay, are you thin on the outside, fat on the inside,
Mhm.
metabolic, and healthy labs can guide. But generally, I look at the waist to height ratio. I like to kind of aim for 0.5 or less long term. That seems to be the best correlation with increased visceral fat, abdominal circumference. But I look at insulin level, glucose level, A1C level, triglyceride, HDL, C-reactive protein for inflammation, the liver function test. Sometimes they're in normal range, but they're on the high end. That can indicate some fatty liver. So there's stuff I look at, overall blood pressure. So all those things, and it depends on the person. So body composition, sometimes, I recommend DEXA scans if people want to do it to kind of see where the fat is distributed, percentage body mass, and improve muscle mass. So
Absolutely.
yeah.
Do you use any, or I'm sure people come to you on metformin and things like that. Do you utilize those things or do you try to help people come off of them? Or what are your thoughts on drugs like that?
Uh, Usually, I like to get people off drugs. I don't use drugs unless I have to.
Mm,
So if someone comes on metformin, I don't stop it immediately. Like I would leave it until they're improving their health. But when they
mm,
come on insulin and other diabetes medications that are risky to with low carb, and then I quickly start backing off and taking them off medications as they improve their diet.
yeah,
I just never drugs is never my first option or
yeah.
second or third option. It's really extreme cases. Like I had a guy actually today. He's been doing this for 3 weeks and his glucose is stuck at 300. He's really not eating anything. Just flat line. It's not. There's no spikes on the glucose. He has his CGM
Oh,
on, but it's stuck 250 to 300. And I was like, I don't want to leave him there. So I was like, okay, he was already on metformin. So this is when I added another. I told him temporary just to get it down.
mm,
Uh, Maybe try to push some fasting until to get to a healthy range. Then we can back off the medicine.
yeah, that
So
I
I
would,
use drugs. I'm not anti-drugs, but I just use it strategically, and for a short time.
yeah, I think that's the way to do it. Cause I think we kind of demonize all drugs. But occasionally, and there's people that have swung so far in the other direction that they're like, all, drugs are evil and bad. And I'm like, well, you don't want to be on them for your entire life. But sometimes, like you just mentioned with a gentleman with a blood sugar of 300 that's kind of flatlined, he might need some assistance while he's making these other life.
Yeah, exactly. Yeah. And then I
Yeah.
gave him a chance and he was open to it. I mean, his goal is to be off drugs. I mean, even Ozempic for him, he couldn't tolerate it before me. He's like,
Really.
he's 3 days where he's sick to his stomach.
Oh, yeah.
So that GLP-1 for him isn't an option. And I don't like it anyway, unless
Yeah.
it's absolutely necessary. So, found other drugs to bring the glucose down and then monitor him closely.
Yeah, I was going to ask you how you felt about the GLP-1s because I had Dr. Tina Moore on the show. I don't know if you're familiar with her, but she's kind of been talking more about microdosing like trizapatide and some of the peptides and not necessarily doing high dose like Ozempic does. And I don't know, I have mixed feelings on it because again, like the man that you just mentioned, he can't tolerate Ozempic. It's probably way too high of a dose, probably cause GI symptoms and things like that. And then some people are like, just don't open Pandora's box, just don't even talk about those things, deal with those things. But I'm always curious. I always look at these things with like a sense of curiosity, especially as someone who's a medical doctor who can prescribe things.
Yeah. Yeah.
Yeah.
I made it a policy that I don't prescribe them.
Mm,
I help manage them. I can get them off.
mm,
I don't rush to get them off. So if someone comes on Ozempic from someone else and we work on the habits and eating right, all that stuff, then we can get them off medications. And plus, people who come to me, they know I'm here to help them come off medications. So I'm not going to default to prescribing them. They work, they're a tool, there's a place for them, but there's way too many side effects and not enough long-term data like for me. And plus, I don't want people to depend on it because
mhm.
we like comfort. So if oh, I'm losing weight while I'm eating my chocolate cake, then it's going to actually harm them in the long run because they're not changing their habits. And what's the end point? So if they come on this drug, I ask them, what's your end point? Or
Right.
indefinite, or you want to come off of it, it does help for people who are struggling. I mean,
Mm,
sometimes you fail, you do everything, they're doing everything, and they fail. And that drug seems to kind of switch that appetite, uh, switch off, and then they're able to focus on eating right,
the right
start
things.
losing weight, and then come
Mhm.
off the drug. And I'm all for it. But generally, I don't personally prescribe them.
Yeah, I'm always kind of looking and seeing what people are saying out there. And it's the mainstream message that is still happening with these weight loss drugs that I really think is just detrimental to everyone is that people are basically saying, I'm still eating all my favorite foods. I'm just eating less of them and I'm not binging and I'm still eating, my favorite breakfast sandwich and my favorite deli sandwiches and my favorite desserts. I'm just eating less of them. And I'm like, but you still, like, what are you going to do when you come off that drug and you no longer have the appetite suppressant effect and you go
Yeah.
back to eating the full portion of those foods? And then your body's not getting the nutrients that it needs from
Right.
these sandwiches and these pastries and these desserts. It's just filling your body full of,
They're gonna lose muscle when they just do that. They're just eating less of everything, and they're not
yeah,
getting enough protein to begin with.
yeah.
So, so yeah, it's very important. Even if you're on this drug, to prioritize protein, exercise, because it's known you're gonna lose your muscles
Hmm.
along with the fat. You know, it's not good.
Agree. Yeah, I don't know, it's just more of that all foods fit message that I think is just really,
It's bad.
it's detrimental. And I see the other side of it. I see these, I think maybe they're well-meaning people on social media, and they're just saying, oh, people are uh fat shaming, and they just, they're not understanding the average person. But I have family members who I love dearly. And like I said, I go into their homes and all I see is these pretzels and candies
Yeah,
and
yeah,
cakes. And they say things like, oh, all foods fit. There are no bad foods. And I'm just like, but they're not actually like food.
yeah.
They're just,
I gave up. I don't. I mean, I notice. I don't say anything unless I'm asked. But generally, it's like, hey, is it working for you? If it's working for you, you're healthy. Who am I to judge? I mean, if you're not healthy, then you got to put one and one together. You got to do something different about your diet.
it's tough because yeah, you don't, I never say anything unless someone asks me, but it's like these same people, their 7-year-old is pre-diabetic, and the mother's getting a CPAP machine, and
Right.
one of the other ones is getting on blood pressure medication. And it's just like, these things really are very preventable and treatable if you stop eating this poison, right?
Yeah, but they can't fathom that. I mean,
Oh.
I don't know. I mean, I think we've all been there, but I don't know what it takes for them to wake up with short of a health crisis, which is
Hmm.
sadly the common reason people change: a heart attack, a
Yeah.
stroke, cancer, whatever. Uh, but yeah, kids with obesity I think, is a crime. With diabetes, pre-diabetes, autoimmune. I mean, they're the unhealthiest generation in history
Yeah.
in that age group.
Yeah, it's unfortunate. It's like the thing is, like, as an adult, like, you're getting to make your own decisions and do what you want, but the child, that's what gets me the most angry, is like the children don't have a choice. The children are eating what you're feeding them. And yeah, it's people that I love dearly that I'm watching this whole thing play out. And I'm like, well, I I'm not going to be I'm just going to be here. If they decide that they want help and they want to shift things, I
And they
will.
see you how you feed your kids, right?
Oh yeah, because I bring food for my son if we're going over there, and they're having the pizza and all the stuff. Like, I will bring food for him. Not to say that he'll never be able to eat a slice of pizza, but he's 19 months old,
Yeah.
and I don't want to deal with behavior and mood issues, any of that stuff from him eating artificial food dyes and all that stuff, because I do see it make. I have an older child that's 16, and she's got autism and a lot of other issues, and it's like I have seen her get a hold of foods like that over the years, and a dramatic difference in her behavior.
Ah.
And so I'm like, my son, I'm not going to introduce him to that stuff at this age. And I mean, they think I'm weird. And my mother is always like, oh, just let him just let, the grandparent, just let him enjoy it. And I'm like, no, maybe when he's a little bit older and he starts noticing and caring, but he doesn't notice or
He
care.
doesn't know. He hasn't tasted it, so he's not gonna miss
He,
something he hasn't
he
had.
just wants to play in the dirt outside, and he wants to play in the water and play with the trucks and play with the toys. Like, he doesn't care what you guys are eating. Like, it doesn't, it's not, that's your,
Yeah.
it's an emotional thing. And I think
Yeah.
I don't know if you see this, and I think you kind of briefly mentioned this earlier, the emotional aspect of nutrition and food. And I always tell people, it's a poor relationship with yourself. It's because it's like everyone says, oh, it's my relationship with food. And I'm like, yes, it's how you're improperly using food. But at the root of it, it's about your relationship with you, you know?
Yeah. Yeah.
Yeah.
I mean, people end up doing a lot of personal work, like emotional work, while just filling out their food log, you know, answering the question, why did they do that? And then facing their own reasons. And people wake up to what's happening. I was like, oh my God, I didn't know I was such an emotional eater. I was stressed, I'm sad. Uh, they soothe with dopamine rather than dealing with the problem.
Mm.
Yeah.
Yeah. And
Hard.
how do you deal with that in your practice? Because I know, I mean, I don't think you can separate the nervous system and the emotions from the habits. Yeah, I think
Yeah.
they all come together as a package.
It's tough. I mean, I feel like I'm a psychotherapist half the time. Sometimes it depends on the extreme. Some people I recommend they seek help, but generally I tell them, look, your brain is sitting in the same soup environment that your heart and liver and kidneys. And so when you feel bad, it's because a lot of it could be sure trauma, PTSD, whatever, but it could be just metabolic that you just don't feel good because you're eating bad. So improving your diet will help improve your mood. The irony here, but at that time, all they want is junk, so it only makes it worse. So I keep reminding them, when you give in to stress by eating junk, you just made it worse for yourself. I mean, just your stress is worse, your handling of stress is worse, your anxiety is worse. So when they start seeing that way, they try to not, seek that 5-minute reward and then aim for the long-term benefit of that. So it works for a lot of people.
I think they just have to do it, because
Yeah, they
for
have to do
me,
it.
that's why I stayed carnivore. Carnivore was going to be like a 30-day experiment for me because I was just having the joint pain and just like all these things happening in my body at age 39. I'm like, this is not normal. And so
Yeah.
it was a 30-day experiment and all the joint pain and all the stuff went away. But it was the mental clarity and feeling the best mentally I had ever felt before that made me stick with it for so long. I just was like, I've been on antidepressants and anti-anxiety and all these different medications that never did anything for me compared to what just cutting out everything for 30 days has done,
How long did you do carnivore for?
2 years.
Oh, 2 years. Okay.
I did it for 2 years straight. And then I stopped because I was trying to get pregnant and my hormones were not, were not optimized, unfortunately, after 2 years of carnivore. Cause like you mentioned, I think a lot of women, they
Get
need
too
to be,
lean or.
I wasn't even too lean. I just, my thyroid downregulated. My sex hormones were really low. I
Okay.
think I'm just one of those people that needs to do a little bit of carb cycling strategically because that's
Yeah.
all that I did. I just added in like one day a week where I'd have, some potatoes that I made in my
Yeah.
air fryer with butter and like ancestral foods. It was like 1 or 2 days a week of carb cycling and I got all my hormones back up. My thyroid came back up and um,
Yeah, yeah. I don't feel like, yeah, I feel the same. Like even I'm like 80% animal based, but I do still eat stuff that are clean. I have sushi, rice sometimes. I love sushi. I may make duck fat fries or eat some fruit. So I'm not like a purist or dogmatic about it.
Yeah. I think that's where you want to get to, and I
Yeah,
did a lot of gut healing and did a lot of kind of emotional work when I was doing carnivore too, just to kind of deal with all that stuff of like, how did I get so unhealthy in the first place? And now, I've added in circadian stuff and quantum biology, and my body is resilient. So if I want to eat a slice of pizza or if I want to have something that's like not ideal and I don't
yeah,
do it often,
yeah.
but it's like once in a while, then my body is able
Able
to,
to recover. Yeah.
it bounces back.
That metabolic flexibility is important.
Yes.
Yeah.
Yeah. I think it's really, really important.
Yeah.
But I don't want people to, I think what happens in the metabolic flexibility conversation is that person that I know is coming to you that has 100 pounds to lose and they're like, oh, I need to be metabolically flexible. And I'm like, no, you don't need to, you don't need to carb.
Well, yeah, you will be by breaking the insulin resistance, so you have to be restrictive for a
Yeah.
long time before you can get to that other side. Yeah,
Yeah, it's just so it's hard. Like you said, it depends. It always depends on the person and the situation as far as like how you need them to approach nutrition, right?
absolutely, absolutely. But that's the fun of it.
Yeah, absolutely. What would you say is like the most difficult case you've ever dealt with?
It's always emotional. Like people who like know what to do, they can recite it every time, and they go and then they don't do it. And getting through to them, and usually we're binge eating
Hmm.
behavior, psychological issues like depression, anxiety, then keeps always sabotage themselves at the end of the day. It's those people that's hard. Like I had a guy I worked with for a year or two going in circles, like
Hmm.
alcohol, people who drink.
I was going to ask you about alcohol.
Alcohol, yeah. I mean, I don't like to drink. If I drink, it's rare, but generally, an occasional drink, I don't make a big deal out of it if it fits their lifestyle and they're getting to their goals. But generally, people who drink regularly, it's never, it never works in their favor.
Yeah.
But yeah, challenging. So I mean, I have a woman I'm working with for over a year. She's so insulin resistant. Like I would make her fast 3 days, and her glucose would still be high. And
Wow.
she was using drugs, but initially, slowly, I mean, she shaved off 40 pounds, and the waist
Wow.
is coming down. So now she's becoming a little bit more responsive. But sometimes you just have to trust the process and do the same thing for weeks without anything obviously changing, knowing it will change at some point. So uh, yeah, everybody has their own challenge, but people who have like they know what to do, but they just don't do it,
Hmm.
I
Yeah.
feel helpless, and that's frustrating.
It's hard. And then the thing of like, oh, I'm doing everything you're saying to do, but I'm not having any results. And then you ask for like a food log or a food diary, or can I see your blood sugar, your ketones? Can you log that for me? And then you just kind of get radio silence. You're
Yeah,
like,
yeah, yeah. By default, I start from the beginning with food logging, and it depends. Not everybody is on a glucose monitor, but if they have issues like that, they monitor. So they log everything, and then the weekly accountability seems to be accountability is the greatest thing because I realize if I just do a consultation and tell them what to do, 90% of people will just not gonna do it. Or they do it for a day or two, they get through the keto, whatever flu, and then just like give up.
yeah.
Only a small percentage are so self-motivated that they'll do it. So accountability, holding their hand virtually, and then really walking through the first few weeks, see the other side, that does magic.
I agree. Yeah, it's so important to just support people, and that's why I don't do one-on-ones, because I just can't do one-on-one because it needs to be multiple sessions. And with my kids, and I've just got so much going on in my personal life, it's hard for me to do that, so I've
Yeah,
got a group for accountability. But I think if somebody really is like, okay, I need to make changes, that they have to be accountable to someone,
yeah.
where they're bringing things in and they're talking, charting progress. And I think that's just the way human psychology, it works that way.
Yeah, yeah. It works that way. Unfortunately, it's hard to scale when it's one-on-one,
Yes.
but it is the best for people who need help.
Yeah.
You know,
Well, that was going to lead me to my question of like, how do you set up your practice? Can people work? Because I know people are going to listen to this and they're going to say, okay, I'm sold. Do people work directly with you? Do you have people that are working under you? I know you have kind of, let's talk a little bit about your
yeah,
setup, and clinic, and all of
absolutely.
that. Yeah.
So right now I'm still a one-man show because I like to control the message.
Mm-hmm.
But I'm at a point where I'm starting to think about having a health coach that I can trust or train to
Mm-hmm.
do the week-to-week stuff. But right now, the way it's set up, people, if they're interested in working with me, I don't sign up people just blindly. I'll have to talk to them first. I do the discovery call. I want to make sure that it's a good match. They're seeking the thing that I can provide. And then if they do, then I do the consultation. I schedule 90 minutes with them to go over the details and then share the food log and then start the weekly check-ins for a 16-week program. That's generally the baseline program. And it could be tailored for diabetes, obesity, you name it, for the individual need. I tried group settings before. I just need more people with me. I can't do it alone.
Yeah.
Uh, yeah, and so now I'm thinking of, just taking care of the medical stuff and having coaches or nutritionists who will follow the same message to to handle so that's going to be my next thing too. And I'm working on the side as well with Rivero.
Oh, nice.
Yeah, so that's been taking a big chunk of my time. Rivero, I was helping them build the protocols before their launch. So you're probably familiar with yeah. So Rivero is Sean Baker, and he's a carnivore, but the program is more about, mass scale, helping people get off medication, healing with nutrition. It's not particularly carnivore. It's more of a low carb, animal based approach, and then a lot of individualized care through app driven format. There's a coach in the app and stuff like that. So part of my work is with them, and most of my work is for myself.
Nice.
And I'm on social media, Twitter, X, Eli Jarrouge MD. I post a lot, and my Instagram, Eli_Jarrouge. And if you read my post, nothing fancy. I don't do reels. I don't have a media team, but I write a lot. So it's really, if people read my post, they don't need to pay anyone if they actually can follow it.
I think I love the simplicity of the message that you put out there. And I think it's needed, especially today. There's a lot of people that can complicate things too much. And when you're looking at the average person is so out, like you said, they just haven't woken up and they need a very simple message. They don't need fancy, complicated. They just need this message of simplicity. So that's why I brought you on, and I wanted to.
Thank you.
Yeah. And if anyone out there is listening, it might not even be you. It might be a family member or somebody who you're just like, okay, this is a great way. It's very simple for them to kind of see this and say, okay, this makes sense, Yeah. So I really appreciate all the work that you do, and happy to support your message, and can't wait to see what kind of things you come out with in the coming years. So
thank you. I really appreciate you inviting me.
Yeah, thank you so much for being here. And I'll make sure that I include your website and how people can follow you on social media in the show notes. And
awesome. Thank you so much.
Yeah, thank you. Thank you so much for listening to the Evolving Wellness Podcast. Just a quick little reminder, this is not medical advice nor meant to be taken as a substitute for working one-on-one with a healthcare practitioner. And if you enjoy the show, please head on over to Apple or Spotify to leave the show up to a 5-star review. If you're over on YouTube, please leave us a like, leave us a comment. I really appreciate you for being here, for listening to the show, and your support means the world to me as I continue to try to pull guests from around the world to bring you informative content to empower you to make decisions about your own health. Thank you so much for being here, and I look forward to seeing you again next week.